Hello, my name is Tyler and I'm a current P4 pharmacy student. I'll be talking to you about direct oral anticoagulants known as DOACs, DOACs, in cancer venous thrombus embolism prophylaxis. Just to note, this presentation represents the opinions of myself based on the references at the end of this slideshow as of July 20th, 2021. Let's get started. So a little background on venous thromboembolism in cancer patients. Around 1 in 5 of all VTE cases are found in patients with oncological disease. The risk of occurrence of VTE shows a 4 to 6-fold increase in patients with active oncological cancer compared to the general population. Standard prophylaxis regimen consists of low molecular weight heparin, LMWH, or heparin, which can only be administered as an injection. This can lead to barriers in therapy as patients might have a needle phobia or have a lack of dexterity to properly administer injections. Now let's look at the American Society of Hematology's 2021 guideline recommendations. For treating a venous thromboembolism, they suggest using DOACs, apixaban or rivaroxaban, or low molecular weight heparin for initial treatment. The period of initial treatment is 5 to 10 days, and only apixaban or rivaroxaban are approved for this period. For the short-term treatment of VTE, so around the first 3 to 6 months for patients with active cancer, the American Society of Hematology guideline panel suggests a DOAC, either apixaban, edoxaban, or rivaroxaban over low molecular weight heparin. It should be noted that DOACs should be used carefully for patients with GI cancers because of the higher risk of GI bleeding. It is also recommended to not use DOACs if a patient has a severe renal impairment, which is defined as a creatinine clearance less than 30 milliliters per minute. For patients with active cancer and VTEs, the guidelines suggest long-term anticoagulation for secondary prophylaxis, so greater than 6 months, rather than a short-term treatment alone, 3 to 6 months. So they suggest using a DOAC or low molecular weight heparin. So now the DOACs that are used in VT prophylaxis are Eliquis, which is apixaban, or Xarelto, rivaroxaban. Eliquis is 2.5 milligrams by mouth twice daily for up to 6 months, whereas the Xarelto rivaroxaban is 10 milligrams by mouth once daily for up to 6 months. It is important to note that rivaroxaban is once daily dosing, whereas apixaban is twice daily. Xarelto might be more beneficial for patients on adherence who would do better with taking less tablets and only once a day. To wrap up, direct oral anticoagulants, DOACs, are an option for VT prophylaxis in cancer patients. Patients who are not at risk for major bleeding should be considered for thromboprophylaxis with a DOAC. For patients with drug-drug interactions with a DOAC or severe renal impairment, low molecular weight heparin could be considered as an alternative therapy. And here is my work cited. Thank you very much for listening.